Healthcare isn't just about medicine, it's about people. Every day, healthcare professionals face challenges that can't be solved by clinical expertise alone. They require trust, communication, leadership, innovation, and a willingness to see care from a different perspective. On The Exam Room with Dr. Rhiannon Windsor, we explore the ideas shaping the future of healthcare through conversations with remarkable people from inside and beyond the exam room. Over the past 3 episodes of The Exam Room, Dr. Eric Black has taken us through the experiences that shaped his career and his approach to healthcare. We heard about his calling to serve, the importance of listening and making every interaction matter, and the ways his team is breaking down barriers by bringing care directly into communities. Now, we turn to a question that connects all of it. How does oral health fit into the health of the whole person? In this final episode, Dr. Black explores the connection between the mouth and the rest of the body, why oral health deserves a place in the broader healthcare conversation, and what decades of caring for patients have taught him about people, connection, and compassion. Dr. Eric Black's story is a reminder that better healthcare isn't just about what we know. It's about how we connect, how we listen, and how we care.
What do you see the PCP's role being in oral health?
I think referring to a dentist and just including this in the conversation. So like when you go for your maybe yearly checkup, just to have the PCP say, hey, do you see a dentist? When's the last time? What'd you do? Was it an emergency? That's different than, oh, I go every 6 months for an exam and cleaning. If so to ask the questions, just take a couple more seconds and just ask, what did you do? Do you just go, because if someone says, yeah, I went in last week, how about before that? Oh, I went in 20 years ago. Okay, there's no like routine set up.
Right.
So it's a little different. But if someone comes back and says that, they only go into a dental office when there's an emergency, well, then you would want to definitely reinforce the importance of seeing a dentist once a year as part of your total health plan to take care of yourself. Just to include us in the conversation. I get my yearly exam, and I've never heard them mention dentistry, I don't think.
I do get asked, for my annual wellness visit, a bunch of other questions. Did you get your mammogram? Did you, the litany of things. But I don't think I've ever been asked when I saw a dentist last. Maybe vision. I think they might ask me about eye exam, but I can't remember ever being asked about when I saw a dentist last.
Yeah. What's good for PCPs to do too is to find a dentist they like. Find someone they agree with their practice philosophy, their demeanor, and how they treat people. And then if you can pair up with a dentist that you feel comfortable with, that PCP should say, hey, I know somebody that will treat you right and take care of you and do what's necessary. Are you interested? Here's a lead. That's it. You don't have to be pushy or do anything beyond that, but just to give someone some direction in case they don't know where to go. Or, a lot of folks, of course, they trust their doctor. And if your doctor says, go here, you're probably going to go.
Yes.
I mean, I do, because it's a big world out there. There's so many healthcare providers. And if you have some kind of recommendation from someone you trust, you'll probably go. But if you have no recommendation, you don't know where to start, it's easy to put it off.
It is. I know I would trust my PCP to recommend somebody. That how I have my dentist now is my dad recommended. Oh, hey, because I had just moved back to town. He's like, oh, well, I see so-and-so and he's really great. They're really nice. I tried them and, I've been there ever since, the last couple of years at least. So
And
yeah,
I think it just takes a moment of interest, right? For the provider just to be interested for a second. When people come to our dental office, I know our providers at UCHC, and I will tell them like, oh, your blood pressure is, super high today. Who do you see? And they'll say, well, I don't see anybody, and I'll say, oh, I know Lisa Kaiser. She's amazing. She's so nice, so kind. Find out some, traits that people have so that you can talk about them.
Hmm.
And I say, she would be happy to help you out. Why don't you try Lisa? You know? So I think to have some contacts or Greg, and I got a list of providers that I can just go through.
Hmm.
Um, so find out, the which dental folks in your community might be able to support you the best if you're a PCP.
I think that's a really great practical tip.
Mhm.
So I have a crazy question for you. In your opinion, if oral health disappeared from the community for 5 years, what do you think we would notice?
Oh, wow, that's terrible. I think you're going to notice a lot of dental disease for sure. You're going to notice people changing aesthetically. I think you might notice behavior change um, as that disease progression gets worse. I think when if it was offline for 5 years and when it came back online, you would see a massive influx of dental patients into the
Hmm.
offices to try to undo perhaps whatever took place during that time off. I think it would be terrible. Here's a good example. So a guy came in the other day with a almost a true hole in the palate of his mouth. It was a big depression. So he had advanced stage 4 squamous cell carcinoma that just popped
Mm.
up, just popped up.
Wow.
So one of our providers caught it, gave him a referral, and then I called him the other day, and he had the left side of the palate resected. So what if you were offline for 5 years and you didn't, society didn't have these services available? Where do you think that man would be?
Yeah.
That's not the first cancer case I saw this month.
Wow.
So, there's big problems that can occur and small ones, but they all are gonna, compound the longer you stay out of the dental world. Unless you're one of the lucky few, which is amazing. I wish everybody was lucky and had no dental problems.
Hmm.
But the oral cavity is like a high maintenance body part. It takes constant care,
Hmm.
unfortunately.
Hmm.
Yeah.
You mentioned behavior change with like oral disease progression. How does poor oral health impact our other body systems or our other conditions that we might have?
It's very common. I was reading a journal before I joined your chat, and it was just on the systemic connection between the oral cavity and
Mm.
the rest of the body. More journals are being published now trying to publicize that connection. There's plenty of research to be done, but you know, the mouth is kind of the gateway to the body, right? And whatever happens here just doesn't stay here. So all that
Mhm.
oral bacteria, inflammation, um, it doesn't just stay in the mouth. It's not isolated there. So it will get passed down systemically to the rest of the body. So, what happens in one area of the body can affect other parts of the body, of course. The formation of say the oral pharynx and the palate. So, if you have somebody that has a narrow, high palate and they're a mouth breather, like what's going on there? What's happening? They have restrictive airway. Are they snoring? They have sleep apnea.
Mm.
Are they waking up through the day? So what happens when if you're not sleeping and you have that condition, restrictive airway, it could lead to, high cortisol levels, more stress, lack of sleep, and then hypertension. So everything's just kind of connected. But, if you had it managed at a young age, you could avoid all those kind of chronic conditions that are coming later on down the road. So
Mhm.
that's just one, easy example of the connection.
I know for me personally, I didn't even know this, but some years ago, I had a hip replacement. And then I went to my first cleaning like after that, and my dentist was like, "Oh, you had a joint replacement." I said, "Yeah." He said, "Well, did you take your antibiotics?" Um, no, what antibiotics?
Mhm.
He's like, "Well, we need to take some antibiotics just to make sure, your hip doesn't get infected." And I was like, "What? What? How? There's a connection?
Yeah.
Okay." So, that was the first that I had ever heard about that or had that aha moment of the mouth being connected with the rest of our body. So,
Yeah. A lot of times it's bi-directional. You think about diabetes, right? There's the big one. Folks
mhm,
with diabetes have delayed healing, increased incidence of periodontal disease, tooth loss. So if you treat one, you know, it's going to affect the other. But if you
mhm,
neglect one of them, it's also going to affect the other too.
that's a great point.
Yeah. So all those like periodontal pathogens, they're not just staying in the mouth, they're going
Mhm,
down, through the circulatory system. And then what studies show is that they're wind up being seen in some of the plaques that are building up in our arteries. So you can, pick out the periodontal pathogens, those bacteria that once originated in the mouth, they're stuck in the plaques that are occluding arteries. But it's also, contributing to the inflammatory process of the endothelium as well. So it's all compounding.
mm,
And I think that, when your like health condition starts to progress, whatever it is, all those little things start to matter even more. And it becomes a little bit harder to manage because it's multi-system.
mhm, absolutely. As we wrap up here, I want to ask, like, after all of these years of serving patients, children, underserved communities, rural communities, Native American communities, what has oral health taught you about people in general?
We all need to be healthy.
Mm,
That's the common thread for sure. We all need the help from others. That's also something that's very common. And I think it's taught me about people is to be patient and to be accepting of who they are. We're not the same. Nobody is. And that's great. Thank God for that. We're not the same, and we should learn to really cherish that. That variety, that diversity is so important. It's a challenge too. And I think as providers, we should look at that diversity as an opportunity to help, to learn. So every time you help somebody, you're actually helping yourself.
mm,
So that is the message I think that I have learned. And the more connection you make, the more people you help. Give the respect, give the time. It's important. Everything you do is important as a healthcare provider. Everything, all the small things that you might think are insignificant, they are not.
mm,
Nothing. Everybody who helps in the process, no matter what their job, it all is meaningful and it all goes to helping like another human being. What more important is that? I don't know.
yeah, I can't think of anything.
I
And like
can't
we
either.
like we talked about before about front office staff, they may not technically think of themselves as healthcare professionals, right? But as that first impression, like you can make a really make a difference in someone's lives. Because I know for me, when I have a healthcare visit, there's a lot going on inside of me, right? Maybe I'm worried about a diagnosis or I'm not feeling well, or maybe I'm there with my mom or my dad because they're having something going on with them. Whatever the case is, that warmth and that connection, even, from the very first person you see, helps to establish the tone of that visit.
Right.
Yeah.
Everything's important. Everything. Yeah.
Yes. One last question for you. What's giving you hope right now?
I think what gives me hope is just being around nice people, amazing
Mm,
people.
mm,
My wife is an amazing person. She gives me hope every day. She's incredible. She's a social worker and just one of the nicest human beings I think I've ever met. But
Oh,
the people I work with give me hope too. I get tired just like everybody else. Um, but when I work in, with those wonderful people, they give me hope, they motivate me, they keep me energized. There's always something that needs to be done, and I think that's refreshing. It keeps me
mm,
going. And I have hope. I mean, you keep doing good deeds will, continue on. It feeds itself. So
yep.
I think that gives me a lot of hope too.
Hmm.
But also being kind. I've worked places throughout my life, and I haven't just been in dentistry, and I've worked around people that weren't kind. I get it. No one's the same. But if it gives me hope is when you find a group of people that are generally nice and respectful, totally incredible. It's life-changing. And that gives you a lot of hope because those particular jobs that I had in the past, like before dentistry, they were interesting. Love them, but
Mm,
not a lot of hope there.
mm,
You know, those particular folks were fighting their own battle, and I think it's better to go through life's challenges together with people that are positive, doing good deeds, looking out for other people. That brings me hope because you can do anything with that kind of like atmosphere.
absolutely. Thank you so much for the work that you do and that your team is doing. And thank you so much for your time and for being with us today.
Yeah, you're welcome. Thanks for having me.
Yeah, we appreciate you.
Thank you.
Thanks for joining us for this special series of The Exam Room. If you enjoyed the conversation, subscribe wherever you listen to podcasts, and join us for more conversations that challenge ideas, inspire action, and explore what can make healthcare better. We'll see you next time on The Exam Room.